Okay, good morning, everyone. Thank you for joining today's workshop. And once again, we have a privilege of having Dr. Cecilia Kai joining us for this workshop. And the topic is memory loss and dementia. Let me give a quick introduction to Dr. Cecilia. Dr. Kai is a geriatrician from Baltimore, Maryland. She served as a medical director and attending physician at two rehabilitation and skilled nursing facilities. She completed internal medicine residency and chief residency in quality improvement and patient safety at Baylor College of Medicine. She completed additional training in geriatric fellowship at Johns Hopkins University. Currently, she also assists in teaching Johns Hopkins Geriatric Medicine Fellows. So let's give a warm welcome to Dr. Cecilia Kai.
Good morning, everyone. Thank you for joining us on a Saturday morning. So hopefully we will be sharing some information that will be helpful to you guys. So I will start my screen sharing. All right, can everyone see the screens?
Yes.
Okay, great. All right, so yes, so let's get started. So first I wanted to do a quick Zoom poll. Ding, I didn't know if you had a chance to do this. Ding, are you there?
Yeah, sorry. Yeah, I did. I need to make sure, you know what? Hang on a sec. I'm not sure why the poll is not launching right now. Whoever just log in Zoom 5, can we try to see if we can launch from there? I may just have to skip out and come back real quick.
Oh, I see it.
You see it? Okay, good.
Great. Yeah, I just wanted to get an idea of the audience and see how we can better tailor our talk. All right, so I think we have more than 85% of our participants already answered the poll. So thank you for everyone. Looks like most of us, 76% of us are relatively healthy. That's great. And you're just here to learn. There's a few of us, about 10 of us, that are current caregivers of a family member of an individual with memory disease. So that's really interesting. So even among our small selection group here, about 48 of us, there's already 11 of us, about 25%, that have some sort of connection to someone with memory disease. So you can see how common this disease is among all of us. So thank you again for participating. All right. All right, so for our session today, I have three main objectives. First, I wanted to give an overview of different memory loss disorders in our elderly. Second, I'll be reviewing strategies to improve your cognitive health. And third, we'll be discussing tips and recommendations for caregivers of loved ones with dementia. First, I'm going to use this nice graph to talk about the spectrum of cognitive impairments. So on the y-axis, it's aligned for cognitive decline. So the lower it goes, the worse the decline is. And then on the x-axis, it's a time in years. So for most of us who have normal aging, everyone can expect some slight cognitive changes during aging. So that's shown by the green lines. So most of us may be up here. As we age, our cognitive decline is very small. Some of us, again, depending on different medical conditions and genetics, we may have a slight more decrease in average, but still considered normal. For some of us who can progress to more memory loss disorders, there's a stage called the preclinical stage. This is the stage where your brain can already be experiencing some changes, but you don't really have any real measurable symptoms. So the individuals themselves may notice a few changes, but they're not really detectable on the tests that the doctors will do. This is a stage where we call the patient would know it, but the doctors doesn't. And then that can progress slowly over to more issues. So there's a condition called the MCI, or mild cognitive impairments. It's a condition where the symptoms become more noticeable to the affected individual and or family members. But the impairment is not significant enough that it affects your daily activities, but still it's noticeable and you can detect it with different assessments. For some people with MCI, they stay stable, their decline is very, very gradual, and some of them may even improve. But there's a percentage of MCI individuals, about 10 to 15% of them, can progress to more severe dementia over the years. And in dementia, you have significant loss of your intellectual ability, your cognitive functions, and they become severe enough that affects your everyday functioning. And there's different stages of dementia, so mild, generally mild, moderate to severe. And it can become progressive over time. So as we age, a question we often ask ourselves is our forgetfulness normal or not normal? So again, as I talked about before, as we age, it's normal to see some changes in our brain. We do lose some neurons. We can have occasional forgetfulness, and that is okay. So looking at this chart for normal aging, so sometimes we can make a decision, bad decision once in a while. We may forget a monthly payment, again, occasionally. Sometimes we may forget which day it is, but we remember later. Or sometimes we may forget which word to use, but it's able to remember later. And we may lose things from time to time, but it's not all the time. When we compare that to dementia, or specifically in this chart is Alzheimer's disease, we're consistently making poor judgments a lot of the times. We have, problems making those monthly bills. We're forgetting it consistently. We're often losing track of the date or time of the year. And sometimes we're oftentimes find having trouble with words and has conversations. And we're misplacing things very often or not able to find them. First, I wanted to talk about the condition called the MCI, or mild cognitive impairment. Again, as I mentioned before, it's a condition where your memory or cognitive issues become noticeable, but they're not severe enough to interfere with your basic living skills or your work. It can be because of a variety of medical and mental health issues or conditions, and it can become a precursor to more progressive dementias like Alzheimer's. As I kind of mentioned before as well, 10 to 15% of people with MCI can progress to Alzheimer's dementia every year. But there are also a majority of people with MCI who do not progress to dementia, and some of them may even improve for not very clear reasons. But what is dementia? Dementia is actually used as an umbrella term. It's describing a collection of cognitive and communication deficits. The key for dementia diagnosis include memory loss, deficits in your executive functioning. That means your judgment and thinking impaired. And you can also have communication impairments, and you can also have changes in your behaviors and your attention and concentration. For a dementia diagnosis, your symptoms have to be severe enough to impair your daily life and affect your independent functions. A quick overview of dementia statistics. So about 11% of people, that's about 1 in 9 adults age 65 and older in the US have some kind of dementia. And about 16% of people age 65 and older in the US have mild cognitive impairments. Specifically for Alzheimer's dementia, which is a type of dementia, there's more than 6 million Americans who are living with Alzheimer's. Actually, then this number is expected to increase. By 2050, this number is projected to be nearly 13 million. Also, 1 in 3 seniors would die with Alzheimer's or another type of dementia. And this number actually kills more than breast cancer and prostate cancer combined. As you may be aware, COVID-19 also has affected our older adults disproportionately. They develop more severe symptoms and associated complications from that. And in 2020, COVID-19 has contributed to a 17% increase in Alzheimer's and dementia-related death. I wanted to go over the different types of dementia. So as I said before, dementia is sort of an umbrella term. And under the big umbrella of dementia, there are many different disease-specific dementias. So the most common type of dementia is Alzheimer's disease. It affects about 50 to 75% of all patients with dementias. It's due to a buildup of abnormal proteins, amyloid and tau proteins in the brain. And the second most common is called vascular dementia. It's about 20 to 30% of all dementias. It's caused by microscopic bleeding and blood vessel blockages in the brain. And there's also a third type that can also be very common, but hard to diagnose. It's called mixed dementias. It can be a combination of Alzheimer's and vascular dementias or the other types of dementias. So you can have more than one type of dementia. And the other types are not as common. So Lewy body dementia, frontal temporal dementia, and all of the other types listed on the right, like Parkinson's disease, Huntington's, HIV, alcohol-related. There also can contribute to dementia symptoms, but they're not as common. This is a nice kind of diagram. I just wanted to show about the physiology of dementia. So dementia is the result of real physical changes to the brain. It is a physical disease and not part of your normal aging. So in this picture, we're comparing the normal brain on the right and degeneration from dementia on the left. So you can see on the brain side that has dementia, the brain is atrophied. It's a lot smaller than the normal brain on your right. And in dementia, there's also different abnormal proteins and damages to the brain cells that's affecting the connections between cells and leading to these real kind of physical changes to your brain. There are many different signs of dementia. These are some examples of 10 signs of dementia that are common. So for example, having a lot of forgetfulness day to day, misplacing your keys and doing that very often. You have problems kind of communicating in conversations. You often forget the words and have trouble remembering what the word is that you wanted to say. You have difficulty with kind of just even simple tasks or remembering the instructions. You can have poor or decreased judgments in a lot of situations. You can have changes in your mood or behaviors that seems new. You can even sometimes have changes in your personality. And you often get confused about time and place, about where you are. And you have difficulty kind of with problem solving. Many of the dementia conditions can be progressive, meaning these symptoms can start out very slowly and they can gradually get worse. So then let's talk about diagnosis and treatments of dementia. So there's not one definitive test that can determine if someone has dementia. Dementia is what we call a clinical diagnosis. Usually the doctors would diagnose dementia, or whether it's Alzheimer's or other types of dementia, is based on a careful medical history. And we take the history to assess kind of the characteristic changes in thinking and behaviors. We also do a thorough physical exam. And generally, we also order different laboratory tests and imaging that can be supportive of the diagnosis. And we also want to rule out other more reversible causes of memory issues like thyroid disease, vitamin B12 deficiency, syphilis, etc. It can be diagnosed by a primary care doctor, a geriatrician, neurologist, or psychiatrist. And generally, we start off with simple cognitive assessments. They're called MoCA or MMSE, and I have a picture of what that looks like on the next slide. Talking about general treatments for dementia, unfortunately, there's still no treatment to cure dementia, or even to delay or stop the progression of dementia like Alzheimer's disease. But there are treatments available that can temporarily increase in functioning or improve the behavior of our individuals with dementia. Some of the most commonly prescribed medications are called donepezil and memantine. And generally, we continue those medications if they're found to be helpful with behaviors of dementia patients. They can have side effects though over time. And so generally, we recommend stopping if the patient starts developing some side effects. There is a new dementia drug available, and you might have heard this one on the news last year. It's called aducanumab. It's a new monoclonal antibody that's been developed specifically for Alzheimer's disease. Because when they were researching it, they found that this monoclonal antibody can decrease the buildup of the amyloid proteins in the brain. It's been FDA accelerated approved last year for mild cognitive impairments and mild Alzheimer's disease. It's a very, very controversial drug because the data still for the efficacy of this drug is still not very clear and can be contradictory. It's been shown to reduce the abnormal proteins on imaging, but it's not really been shown to improve the real symptoms or clinical symptoms of dementia. So right now, Medicare covers this drug only for those who are participating in approved clinical trials. It's a very, very expensive drug. Next, some other kind of treatments available include mood medications or antidepressants. These medications can be very helpful to controlling some of the behaviors and stabilize the mood of our individuals with dementia. There can also be very helpful non-pharmacological behavior interventions, such as music therapy, aromatherapy, art therapy, like pet therapy, and physical exercises that can be also helpful for older adults with dementia to help, again, stabilize their moods, control their behaviors better. This is an example of the cognitive testing I've talked about. Very quick and simple tests that you can do in the doctor's office, probably in less than 5 minutes. So the picture on the left is Montreal Cognitive Assessment, also called the MoCA. And the picture on the right is showing the mini mental state exam, the MMSE. Generally, we prefer the MoCA test because it has a little bit more complicated testing of different areas in the brain. And MMSE is a more simple version. Next, I will be moving on to talking about different strategies for improving your cognitive health. As most of us here are healthy, so I hope some of these strategies will be helpful for you. This is a nice kind of picture that I found from NPR. So generally, what's good for your heart is good for your brain. Keeping your heart healthy for as long as possible, and that will likely be helping your brain as well. Our research supports that adopting multiple kind of healthy lifestyle choices, including exercising, having a healthy diet, not smoking, and doing kind of cognitive stimulation activities. All these things will decrease your risk of cognitive decline and dementia. More specifically, these are kind of 9 different ways for reducing the risk of dementia. So as I talked about, increasing your kind of mental activities in whether it's more education or just learning new skills, increasing your exercising and physical activities, increasing your social interaction and social contact, and decreasing hearing loss. So hearing loss actually has been associated with more cognitive issues. And if you do have hearing loss, do get that assessed by your doctor and consider getting hearing aids. Also make sure you're decreasing your blood pressure, decreasing your sugars if you're diabetes, decreasing your weight if you're obese, and do not smoke, and try to improve your mood if you have depression. Some of our research suggests if you're doing all these lifestyle strategies, you can potentially prevent 1 in 3 cases of dementia. All right, I'm going to switch gears a little bit to discuss more from aspects of caregivers. I'll be discussing different tips and recommendations for caregivers of loved ones with dementia. This is a nice quote that I found by Rosalind Carter. There are only 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need to be caregivers. A quick statistic on caregiving. So in America, there are over 11 million Americans who are providing unpaid care for people with Alzheimer's or other types of dementia. And these caregivers, over a 1-year period of time, they're providing more than 16 billion hours. That's valued at nearly $272 billion. So you can see that caregiving is very common in our country. Next, let's talk about tips and recommendations for caregivers. It's very important for your loved ones with dementia to be able to maximize their independence for as long as possible while keeping them safe. They can, for example, help with simple house chores like setting the table, depending on their abilities. You may have to, again, reassess their abilities once in a while as their memory issues and dementia progresses. It's generally very helpful to have a daily routine to help them kind of remember and stay on task. It's also helpful to set up reminders for them to do a certain things. And as a caregiver, it's helpful for you to help plan and organize different activities for the older individuals to enjoy. It can be as simple as just setting up the newspaper or setting the TV channels for them. It's also a great idea to plan ahead of time legally with advanced directives for medical and financial power of attorney. And it's good to think about if their dementia is to progress, how will you be able to take care of them in the future? So thinking of long-term care planning. Will they be safe to live at home? Do you have enough help or finances to be able to keep them at home? Or do they need to be at a facility where they can be monitored more carefully? It's also highly recommended for caregivers to join a support group. And Alzheimer's Association is a big association in the US that have many different local chapters and support groups in person and online that you can be part of. Also make sure you are building your own support network as well with your family and friends. It can also be part of your church community as well. And your support network may be able to provide additional physical assistance, and they can definitely provide mental and spiritual support and prayer. caregiving is really hard work. So our caregivers need to remember that they need to also take care of themselves so that they can have the strength to be able to take care of their loved ones. Remember, you cannot do this alone. So make sure you can ask for help from other people. And don't feel guilty about taking a break. There are care available called respite care, where you can have your loved ones stay in a different facility or nursing home for a short period of time while you take a break or vacation for yourself. There are many different resources available out there for caregivers. Some of the resources are available through the Alzheimer's Association websites. They have a variety of different educational programs and many reading materials available on their websites. The National Institute on Aging and the National Institute of Health also have their own government website called alzheimers.gov that have a lot of useful information. And they have free publications that you can order from them online and that you can read more about dementia and different things. If you take your loved ones to a local memory clinic, the memory clinic themselves will also offer educational programs and resources for the caregivers. This is 2 books I recommend for caregivers. The first one is by Dr. Kales. It's called The DICE Approach. And the second one is by Beth Spencer and Lori White. It's called Coping with Behavior Change in Dementia. Both of these books focus on what the caregivers can do to kind of manage the behavior symptoms of dementia. And again, as I mentioned, caregiving is really, really difficult. And it can lead to a lot of stress and burnout for our caregivers. So these are some signs of caregiver burnout. You can be in denial about the disease and its effect on the person who's been diagnosed. You can feel like anger and frustration that he or she can't do the things they used to be able to do. You can feel more socially withdrawn from your family and your friends and activities that used to make you feel really good. You can feel more anxious about the future or feel depressed, so depressed that it's breaking your spirit. You can feel more exhausted and makes it really hard for you to complete what you need to do. You can have sleeplessness and just feeling tired. You can feel irritable all the time and be more moody and having kind of negative responses to things. You can feel a lack of concentration, making it difficult for you to perform your usual task. And you can start developing health problems that begins to take a mental and physical toll on you. So if you're experiencing any of these signs or multiple of these signs, you need to remember just, again, you need to take care of yourself as well. Try to manage your stress. Try to reach out to your support network. Join a support group. Remember to try to take some time for yourself to exercise to reduce the stress. And try to make plans for the future. Whether you need to consider having your loved ones go somewhere else temporarily for respite care. And you may also need to consider seeking professional mental health help if you're experiencing signs of depression. Remember, respite is not a luxury, but it is a vital necessity for our caregivers. So please do take the time to take breaks for yourself and take care of yourself. Lastly, I have a few takeaway points from this talk. First, our individuals with mild cognitive impairments can have significant memory problems, but they do not affect their daily functions. Individuals with dementia, however, they have more severe problems that do affect their daily functions. And dementia is a common condition and has many different disease subtypes. There is really no cure for dementia, but there are medications and strategies that can help you manage those behaviors. Caregiving is a very difficult task and can lead to caregiver burnout. So our caregivers are recommended to seek help and plan ahead. Lastly, I think I'm ready to take questions.
Dr. Kai, my name is Rennie.
Hi,
Good morning.
morning.
I want to thank you myself for this talk. I think you come from so far and we really appreciate it.
Thank you.
And also on your first survey question, I like to make a comment that although currently because I already lost my mom to dementia, so I'm not a caregiver per se at this time. However, I've been one, and currently my husband's mom is going through it gradually. But what I'm saying is maybe end up with your number is bigger than what you see, from the survey.
Thank you. Thank you for pointing that out. Yeah.
Oh, since nobody is talking, so let me fill in the gap. One more thing that I noticed, because one of our high school group had one person that is taking care of her mother-in-law, and she complains a lot on it, on the group chat. But the unfortunate thing is her husband is a pastor. So it really doesn't look good for other people who sees it who are not Christians, because they probably will say, well, how can, but then for caregivers, unless you are in the situation, just like you point out so many times about caregiver burnout, I think people like that, meaning caregivers, they really need to know, not to the point of burning out, but to take care of themselves so they can take care of their loved ones. So thank you for pointing it out again and again.
Yes,
Okay.
definitely.
And Dr. Tai, we have a few questions in the chat.
Oh.
And one is, what are the common side effects of Alzheimer medication?
So for the common ones I mentioned, the donepezil and the memantine, initially they can have some GI side effects. So you may have some stomach pain, different issues with your bowels, so your stools may become a little bit irregular and can have some loose diarrhea. Over time, they can also affect the appetite. So some people, they don't, and dementia naturally they can progress where you lose your appetite over time, but the medications can actually contribute to that sometimes. They can start losing a lot of weight and just not eat very well, or what we call anorexia. And also some of the medications can cause a low heart rate, what we call bradycardia. And if their heart rate gets really low on these medications, we have to stop the medications. So not everyone experiences these side effects though. Some people tolerate very well and they may continue to take them until they pass. But these are just some of the things to look for.
Okay. We have one other question in the...
A follow-up question on the effects of the medication. Does it cause dizziness? My mom is taking Aricept. So during COVID time, she may have experienced dizziness, but as we could not see her, we do not know the severity of it. So in January of this year, she was diagnosed with mild, like stage maybe like 3 or 4 of Alzheimer. So she started taking Aricept. She has been complaining of dizziness and heavy, like her head is feeling heavy. So the recommendation from the doctors, no one could actually tell us if Aricept made it worse. We were just told to give her lots of fluids. So we are just like in the bind, like she couldn't shake off the dizziness. She always complained that her head feels heavy. So what are your take on that?
Yeah, it doesn't typically cause that much dizziness, though they are, I mean, it can maybe have some neurological symptoms depending on the individual. But dizziness in general is a very common condition in the elderly. It can have many different causes. So I think in this case, her doctors are thinking maybe she's not drinking enough fluids. I would suggest, well, I think one to consider, did she have significant improvement on these medications? Like did her behaviors become a little bit better, like her memory seeing a little bit better on these medications? Because if not, and the dizziness is really affecting her a lot, and the doctors haven't found like many real causes for the dizziness that we can fix, you can consider trying her off of the Aricept for a while. Just kind of decreasing the dose, of course, with talking to the doctors, kind of tapering off the medications for a while to see if it helps improve her symptoms. That's something to consider.
So she started on the 5 mg and progressed to 10 mg.
Mhm.
Always stay on the 10 mg because I read from the internet that for clinical effectiveness, you have to stay on 10 mg.
Mhm.
Is that true? Because the doctors are not very definitive in their instruction. You know, they don't tell us to decrease or increase, and some may even say stay at 10.
Mhm.
You know, decisions are like not, it's given back to the family members to decide.
Mhm.
They are not doctors,
Yeah.
so it's kind of difficult to let us decide whether we should decrease it to 5
Right.
mg or 10 mg.
Right. So usually, yes, we try to maximize the medications because that's really the research studies have shown that's being a little bit more helpful is at the higher doses, not the lower doses. So as I said, if, you know, depending on whether it really helped her symptoms, if you feel like she was, in terms of her behaviors, her symptoms a little bit better on the Aricept than without the Aricept, then maybe you don't want to decrease the dose. But as I said before, if the dizziness, the doctors did, you know, all sorts of other workup, intervention, they didn't really find anything. And the only thing that's really changed in her regimen was the Aricept, then you may want to just try a lower dose for a short time or try to take it off. Don't take it off completely. You would lower to 5 first for a few weeks and then maybe decrease it to see if it helps at all with her dizziness, because definitely that can be a very irritable symptom, can be very not comfortable and can lead to falls in the elderly. So if she's really complaining about dizziness a lot, you could consider a tapering, but I would discuss that with the doctors.
Okay, so it's not a known cause for dizziness. It's
Not typically, no.
okay. All right, thank you.
Okay, let's take some of the questions from the chat. The first one said, great talk, lots of help. I missed what you mentioned about a temporary relief of daycare.
Yes, so I'll talk more about that in my next talk on elderly care services, but respite care is something that is available. So it can be through different rehab or nursing home facilities, or even like adult day centers. This where it's basically you have to be in agreement with them that you're leaving your loved ones here for a short period of time, and then they'll be getting all the care they have there. And then for your caregivers yourself to take a break. And it can be for hospice patients, it's covered for Medicare can cover it for up to 5 days, or some long-term care insurance will cover it too.
Okay, the next question is, do family doctors usually easily diagnose Alzheimer's according to the symptoms you mentioned on the screen? Because they seem to usually say it's dementia.
They can. I was saying generally, the general kind of depends on their experience and their training. So some of them may have had more training on dementia specific diagnosing. They can, in general, they're able to diagnose kind of general, again, the umbrella symptoms of dementia. They can generally tell based on your history and when they do their cognitive assessments, whether it's dementia or something else. But usually it's more difficult for them to tell the specific types of dementia, like, is it just Alzheimer's disease, like most dementia, or is it more the rare types, like you know, Parkinson's or frontal temporal dementias. It can be harder for them to distinguish the specific types. And that's when it'll be helpful for you to kind of seek more specialist opinions, whether it's for, from like a memory clinic, whether it's neurology, psychiatry, geriatrics. They're a little bit more specially trained to identify the subtypes, and they can also provide more resources and guidance in like the treatments. They can, explain the treatments a little bit better. They can also provide more resources, and also the specialists are more thorough in working out the dementia as well. So making sure you're not missing something that is actually curable, and just, instead of just reverting by default that, it's not curable.
Okay, one other question on the chat. Can you elaborate on the timeline of the MCI progression in dementia? Are we talking about months, years, or decades?
It's usually years, but as I said, about 10 to 15% of people with MCI do progress to the dementia every year. I mean, they usually progress to the more mild stage dementia, and then over time it can progress to more. But yeah, generally over years. And as I said, a lot of people with MCI, like more than 85 to 90% of them, don't ever progress to dementia. And some of them may even get better. And we're still not quite sure why exactly.
I have a general question. At which point is it wise to consult a geriatrician?
So that's I think I have a graph. Oh, actually, in my next talk, the graph is on my next talk, about the kind of the spectrum of different health services. And so geriatrics generally are more helpful if you're older with multiple kind of medical issues. That's becoming too complicated for like a normal primary care doctor to handle. So doing a normal kind of family medicine clinic visits, they only have 15 minutes to address your concerns. And if you have, a list of more than 5 or 10 concerns, and they're all, very severe, you don't really have time to discuss that with your family medicine doctor. But with geriatrics, usually you have more time doing those visits to specifically discuss those concerns. So generally they have 30 minutes for follow-up and 1 hour for new patient visits. So you can spend more time with your doctors. They can explain your problems a little bit more. And they're also more helpful for kind of providing resources and setting expectations if you're at risk for dementia or you already have dementia. So again, it's not needed for everyone, especially if you're a healthy older adult. But again, if you're experiencing a lot of medical problems, especially if you have dementia, and you will need more caregiving and resources in the future, it may be helpful for you to seek out more geriatric specialized care.
Another question in the chat is related. Do you recommend for an 85-year-old to see doctors other than a family physician? If yes, how often?
If they're, as I said, if they're generally healthy, like their only problem is high blood pressure, and they're taking 1 or 2 medications for high blood pressure, then you probably don't need to see other doctors. It really depends on what other medical issues they have. As I said, if they have, they have uncontrolled blood pressure, they have uncontrolled diabetes, they had a stroke, and they have heart disease. And if they all these different things and not doing very well with their family doctor, maybe then it's time to consider whether you need like a geriatrician, or maybe you need to see a cardiologist to address some of these things. So it really depends on how well their disease is controlled. But there are many great family docs out there, and they can handle majority of these things. But they're unfortunately also very time constrained, and they have a lot of patients to see in a very short period of time. And so, if you have a lot of issues, they really honestly just, even if they want to, they don't have the luxury of time to spend on all those issues.
A related question on that, would insurances cover a geriatrician's visit?
Yes, Medicare does generally. Well, you have to find a geriatrician that accepts Medicare. There's also, if you're more well off financially, there's actually concierge practices that would take insurance in addition to certain fee per year. There's also a lot of geriatric practice that's concierge. But normally geriatric clinics, they generally take Medicare because a lot of our older, well, all of our older adults should be getting Medicare.
This is a question that a lot of us would be thinking about. At what age should we pay attention to our forgetfulness?
I don't think you have to think about it all the time or pay attention to it. I would say if your wife or your friend started saying to you, you've been very forgetful lately, or we had this conversation like 5 minutes ago. If you're getting more and more of those kind of responses, maybe then it's time to think about, is this really normal aging, or do I need to get this assessed a little bit more? Or for most of us, if you have, relatively healthy lifestyles, as I said, and you don't really have a lot of like medical disease, you don't really have to worry about forgetfulness that much.
Dr. Kai, this is Katie. I have a question. I took care of my mother-in-law, but she passed away already. And I remember one time, I feel that she's forget a lot of stuff, and then she had to test, like, there are 2 tests, right? It's the other one, simple test. It's amazing. The doctor asked him where she is, give her all these subjects, and tell her back later in the day. She cannot answer that. But then she prescribed some medication and asked to come back maybe 2 weeks or a month, I forgot. She can answer all those. So how can that be? It's a puzzle for me. Another question is, because my mom is in the 90s, and every time we make conversation, she's not making conversation, she's talking about her past, and she doesn't talk about anything else, or always ask us, are you retired? Even ask my kid, So is there any help for her? Does she need any medication,
Yeah, I think about the medications. So yeah, I'm thinking those are dementia medications, like for example, Aricept is usually the one we start out with. They can, for a short period of time, improve some kind of memory recollection and behaviors. But again, our research shows that they don't really cure or even delay the progression in dementia. But yes, there are cases when you start taking the medications, people say you start feeling, some difference. And then the second part about, sorry, repeat the second question that you had.
Yeah, my mom's 90 something, right? So it's very hard to carry a conversation with her. She just talk about her past, and she doesn't really listen what we say. And then she asks everyone that she saw, like my son asked, are you all retired? Like she doesn't know I don't think she knows, right? Because how can you retire in the 30s, But that's why my concern is that any medication can help, because my brother is a pharmacist. He said nothing can help. So I don't know, but I saw my mother-in-law, it did help her. And I see she had that for a long time because she passed away, so that's why I don't remember the name of the drugs,
Yeah.
But how can it help her, Yeah.
Yeah, so I think if her memory kind of, older people, they love talking about the past. Usually they generally will have a harder time remembering more recent or like new informations. So, but they have great memory in their brain about things that have happened like, many, many years ago. And that's common in our dementia population as well. So she may have some memory loss, but if it's not really affecting her day-to-day living, like, she's not really needing like additional assistance because her memory issues, she's still able to remember to, take her medicines, dress herself and doing her day-to-day tasks, then you don't really need to take medications, unless, again, if it's affecting her daily functioning.
Okay. Because my brother is taking care of that, make sure her medication is correct and that kind of stuff. But another question is because like she says something is not true, she makes up things. And I mean, she thinking people is try to hurt her purposely.
Mm,
So I explained to her, but she cannot take it. So I don't know what to do, you know.
mhm. I think if that becomes very distressing to her, like she gets like very paranoid, thinks that she's gonna get hurt, or you know, having kind of these delusions about things that are not true, and that's really like becoming very distressing to her. She may benefit from some medications, but I would suggest for her to get assessed for kind of mental health issues first, like depression or anxiety. And this is very common in patients who have memory issues. And actually, sometimes when they get on mood medications, these kind of symptoms actually improve without them being on the dementia medications.
Okay, thank you.
Hi, my name is Ya Qian. I really appreciate this talk. I've been taking care of my mom for 6.5 years.
Wow.
And I could tell that just a comment that in the recent 6 to 8 months, her mental health deteriorated very fast. I think there was a sign when she stopped paying, like having a interest of socialize with other people. I think that was a big sign of a decline. She used to be very friendly and enjoy, you know, talking to friends, but in a very short period of time, she suddenly, you know, felt like she was either numb or not like to even join the conversation. So I was wondering if it's possible the hearing loss contribute to that significantly.
Yeah, it can. It can. Yeah.
Okay.
When they have significant, older adults have significant hearing loss, they don't feel like they can participate in activities as much. They may feel they don't want to, you know, intrude on conversations when they don't hear very well. And so if she has hearing loss, she should definitely get that assessed. Just make sure it's not something simple like earwax that can be taken out. And then maybe considering getting some hearing aids or devices.
Yeah, thank you. And then there's a dilemma that when she started to having trouble remembering things, for example, we had a complete full set of denture, but she sometimes tried to put that on her eyes, assuming that she confused that with her reading glass. So I'm just afraid the small device like a hearing aid will go into her mouth, you know, get swollen or choked. So is there anything? I feel like, you know, yeah, she did need help hearing, or else she's losing even more connection with people, right? But just concentrate on the hearing aid seem like add another stress to her routine. And I don't know in that situation what is more important.
Yeah, so yeah, hearing aids are very small, finicky devices, and yeah, all of those like lose them all the time. So there are like bigger devices you can get. Something I commonly recommend is something called the Pocket Talker, and you can find on Amazon for like 20, 30 bucks. They're a little bit bigger, and they're usually connected to like a headphone. You can even get the ones with like wireless, like Bluetooth headphones, or the ones with wires. So those are a little bit like bigger, like, you know, you can change the headphones to whatever is comfortable for her, and they do amplify the sound. It's kind of like a sound amplifier. Look, again, a little bit bigger than hearing aids, but they work quite well. I don't recommend it because hearing aids were like very expensive, and these are a lot cheaper alternatives, but again, they do work well. So you can try that to see if she would be willing to use that, especially when you are trying to talk to her, or in like a social situation where maybe she can participate a little bit more, you know, when she has that device on.
Great, thanks. Yeah, but I just felt like I regret two things that we did not act earlier. Had we started 4 years ago when she showed just a little bit of a signs of needing a hearing aid, she might be already gotten used to it, and it wouldn't be as big of a trouble. And
Mm.
same to the dentures. I regret that we waited till she really need her dentures, and now we're constantly debating whether that she's having too much stress with the denture.
Mhm.
Or maybe she needs to get help, and eat better with that. So I felt like, to other people whose parents are not as advanced in this process, maybe 3 things: reading glasses, hearing aids, and the dental health. We could act earlier to let our elderly get used to kind of like a behavior memory.
Mhm.
So by the time when they're losing it, it was already a habit.
Yeah, and thank you for pointing that out, actually. Like visual and hearing sensories, all these things can affect people's, memory, concentration, different things. So definitely like reading glasses, hearing aids, yeah, keeping those things a little bit more, active and stimulating will help with their memories.
Thank you.
Yeah, there was a comment in the chat that I think you've answered it. There's some hesitancy in using hearing aids in the elderly. Does using hearing aids help with dementia progression?
I do. So hearing loss has been associated with, some memory issues. So for some people who have significant hearing loss, having a hearing aid or something, like I said, a sound amplifier, like a pocket talker, can help to some degree for their memory issues. It doesn't completely, prevent or stop the progression of dementia. As I said, we really don't have anything that stops progression, but they can help to some degree for people who are experiencing significant hearing loss. So I would still recommend it. And one of the things I talked about before is it's important for the older adults to stay kind of mentally engaged and having social interaction. These are all important things to keep your brain healthy. And as I said just before with our other audience member, hearing aids, having these sensory devices really helps with that, keeping them more mentally engaged and stimulated through their senses and participating in more social interactions. So certainly those things will be helpful.
I have a question. We're in a position where we may be flying with our elderly parent who has Alzheimer's. Do you have any recommendation for Alzheimer's patients on a plane?
On plane, I mean, sometimes they may feel very restless when they're sitting, strapped into the same position for a while. Maybe bringing something, a book or some activities that they can enjoy, that they can do on the seat, that may be helpful. Like, I don't know, they enjoy listening to music or reading a book or doing a puzzle, like bring some of those things with you on the plane so that they can stay seated. That may be helpful. And then in addition, if they need like a mobility device, like a walker or things, generally you can't use that like up and down the aisles on the plane. So they may need, some assistance, wheelchair or walker for them to get into the seat. So then you want to be careful, like if they need to use a bathroom or something, they may need additional help to go to the bathroom, or they may need to wear like a diaper or a brief doing the plane ride, so that they're not having to, worry about like going up and down the aisle and trip over things. Yeah.
Would you recommend having any kind of sedation
No,
for the trip?
no, I wouldn't. Any sort of sedating medications like Benadryl or some other sleep medications can have kind of bad effects on people with dementia. They can be very sensitive to it. And certain medications like Xanax can actually make them confused. Benadryl as well can make them confused. And actually causes more problems because when they're more confused than usual. So I wouldn't really recommend it, no. If they're already on like an antidepressant or mood medications already that they take every day, definitely still should take those medications before you get on the plane. but I wouldn't add anything new to the mix.
Hello,
Another, oh,
sorry, can I?
go ahead, Yvonne.
Okay, hi, it's Yvonne. I have just a quick general question. I noticed from your PowerPoint slide about the increase of people with memory loss up to, I think it was 2050 kind of thing. And I was just interested to know, do you think that this, I guess it wasn't noticed like, 20 years ago or more than that? Is it because you just didn't have the data for that? Or is it because and I know you were saying that some of the loss is due to just physical, like, we're not active or we don't make we don't use our brains kind of thing. And I was just wondering, has this increase been due to things like possible environmental effects and stuff like that, we're eating a lot of more processed foods and there's pesticides and stuff like that? Do you have any data on that?
Not really. I mean, in general, we do know the environment factors does play a role into our, aging process and our medical conditions, but we don't really have definitive data to show, oh, it's because of this specific processed food change or environment change that caused to more dementia. In general, we have more kind of dementia diagnosis now because of our aging population. So our whole population is aging more. With like the baby boomers and such. And so with the increasing age, there will be more dementia diagnosis. And as you said, our American population struggles with obesity and a lot of these kind of cardiovascular issues, and they do lead to dementia as well. So that was another factor that's in play. But no, we don't have definitive data on like environmental things, but they certainly could be affecting us, but we just don't know exactly yet.
Okay, thank you.
Okay. There's a question in the chat. Do new environments make symptoms worse? Should we allow a patient to age in place?
Yes, so generally our dementia patients, when they're in an unfamiliar new environment, they will take a very long time to adjust. Their confusion and their behaviors can worsen because they're not familiar with the environment. If you have the resources and support that you need to allow them to age in place, I definitely still would recommend the best. I will actually talk about some of those aging in place resources in my next session, the elderly care services session. But not every family member is able to do that. If you live in different places or if really you don't have the financial resources to hire like caregivers for home. So not everyone's able to allow them, but if you're able to, definitely I would recommend for them to age in place.
So you will put your maybe your close family member into the what is so-called memory care. What you should do? That might be not might be the easy way out, but I'm not sure if that is the best solution or not.
Mm-hmm, mm-hmm. Yeah, I mean, I think it really depends on the severity of their illness and their medical issues. So if you're able to stay with your loved ones and they don't need like someone to be there 24 hours, but just someone to be there during the day, and yeah, of course, that's great that you can keep them at home. And you have, you can either a family member or a hired caregiver can be with them during the day. But I think if it becomes more severe, like they're starting to have issues like wandering outside, or they're needing a lot more help, like as dementia progresses, they're not even able to feed themselves. They're having a lot of continence issues, like urinary or bowel incontinence issues. That's when it can be a lot on family caregivers to take care of them at home. In those cases, you may need to think about like memory care. But I also, really depends on the abilities of caregivers as well and family members. So if you're like working, you really are not able to stay at home with your loved ones. And you also have to be physically, able to. And if you're elderly yourself, you have your own medical issues and you can't help your loved ones like transfer to the toilet or giving them bath, like then, well, you may need more help. So there, yeah, again, it depends on how much help the loved ones need and how much help you're able to provide as a caregiver, how much, finances do you have for hiring extra hands to come to your home. And memory care, there are many different types of memory cares. And some of them are really nice, are quite nice, and they provide, safe and monitored care in those settings. And then, yeah, you don't have to worry as much about them. But that's a personal choice. You have to depend on the, specific individual's conditions and your family situation.
Did you recommend that someone with mild MCI stay home by himself or by herself for, maybe for 8 hours or 9 hours? Is that okay?
Yeah, I think MCIs generally are okay because they are still able to do their day-to-day activities. Like they generally are still able to, they can cook simple things. They may not be able to cook, complicated, elaborate meals, but they can cook simple meals. They remember to take their medications, with reminders. They can have reminders. They're still able to do most of their daily activities, so it should be safe. But you just have to, assess that periodically, make sure they're not having like unsafe behaviors at home, like, leaving the stove on, forgetting to turn it off, things like that. That can be a little bit dangerous. So just assess their behaviors periodically. But yeah, if they're still staying in the MCI stage, they can stay at home.
Thank you.
Okay, so the workshop officially ends at 10:15. So if you have more questions from now till then, feel free to ask. But I just want to plug in that once again, thank you, Dr. Cecilia, for hosting the workshop. And also, if you can see my screen, there is a link for the survey for this session. So if you don't mind, go ahead and use the QR code or the link on top. I'll go ahead and type it in there too. And if you don't mind, give us a little feedback on the workshop. Again, thank you everyone for joining today's workshop. And there's another one coming up on at 10:30. There are two workshops from 10:30 to 11:45. And by Dr. John Shea and also by Melody Lin. And then in the afternoon, we'll resume our afternoon session at 2 p.m. And then again, one more at 3:30 p.m. So thanks again for everyone.
Okay, and we do have one additional question in the chat. First, thank you, Dr. Cecilia, for an excellent and informative workshop. And a question is, 98-year-old mom is in good physical shape for her age. Her parenting style has always been a nagging communication style with us children, even though we are all adults of retirement age now. Over the last couple of years, we have noticed that in a typical visit with her, she will keep returning to and asking the same nagging question of life advice every 10 minutes or so. We've always chalked it up to just her nagging ways, but are curious now if it's more an early indicator of mild dementia.
Sounds like it could be, especially when she's asking kind of these repeated questions, or if you're finding herself like having a hard time coming up the word that she wants to say, like, and yeah, so it could be. But again, dementia, it has to affect her kind of her functions, her day-to-day living. So if it's just conversational and she's not if she's not able, she's still able to, do most things herself, then you may not happen dementia. It might just be, MCI or more milder version. So yeah, she could definitely have it though. And I think Melody's point, the MCI question, it's okay until it's not okay. Yeah, definitely. Yeah, so if she's pretty independent otherwise, yeah, it may be just part of her aging and that she loves asking those life advice questions. But she will still have small microvascular changes to her brain, and she may have some more damages than average, but if it's not affecting her functioning, don't have to worry about, taking medications or anything like that.
Thank you, Dr. Tsai, for such an informative talk. I have kind of a two-part question. After my dad had his latest hemorrhagic stroke in recent decline from a vessel disease called cerebral amyloid angiopathy, they discontinued all his medication except for a couple like steroids and immunosuppressants to help with the brain inflammation. Would you recommend revisiting Aricept or another stronger sort of medication for an advanced stage patient? I just was encouraged by another participant's testimony of her parent who experienced a lot of improvement from that. And then secondly, do you have any guidance on how to continue stimulating an advanced stage patient? He doesn't watch a lot of TV anymore, but so we put on like music and physically engage with him as much as possible. But do you have perhaps any other recommendations by chance?
I would say the dementia medications, they generally works better in more mild and moderate severe cases. In more severe cases, dementia, honestly, they don't work as well anymore. So in our the case of the previous participant, her mother, it may have worked well for her because her dementia is not as severe yet. But it's still a reasonable question to ask your dad's doctor to see if they would want to give it a try, especially if he's having a lot of behaviors or behavior issues associated with dementia. You could give it a try if it doesn't have interactions with other drugs. But in severe dementia, typically they don't have that much help. And then to the other question about mental stimulation, physical stimulation, yes, definitely still very important to do. So yeah, what you're doing already, like music therapy, keeping him like more engaged in conversation, those are already very helpful. You can also try some like physical therapy, occupational therapy. You can get certain like home health care services if he hasn't gotten them recently. Those can be helpful. They do different exercises with them or therapy with them to just kind of keeping up with their functions or improve their functions. You can also just, if he's still willing to read or listen to a book, you can do audiobooks, reading a book or puzzles and things like that, something simple they can enjoy. Yeah, I think it really depends on his particular kind of interest, and every older adult will have their own preference. Like some people loves Legos, some people loves crossword puzzles. So you just have to find like what he likes and hopefully the activity that keeps him, more mentally kind of stimulated.
Speaking of therapy, what do you think about neurofeedback therapy?
Neurofeedback therapy. That could be helpful. There's not as many therapists who's able to do it. So it's not as common. But if it's available, in the doctor's clinic, if they can give you a referral, you could try it. Again, all these different adjunct kind of therapies can be helpful in different ways. But there's no one that's like significantly better than others. But you can try a different variety of therapies and see which one works better for that particular individual.
Thank you.
What about driving? I have a question about how long you can allow someone with dementia to continue to drive?
Yeah, so driving, again, there's no upper age limit for driving, and you're not required to get like medical clearance for driving. But if your family member have concerns about that person's driving abilities, especially if they're, having like a hard time remembering like where to go or even where they are. That's maybe time to think about taking away their keys. But you don't want them, God forbid, to get lost while they're driving and they can't find their way home. They don't know how to use a GPS. So yeah, those are times when I'd be like more hesitant for them to drive. But in more milder cases, dementia, they could still be driving, but definitely as it progresses, like you want to be careful.
I see. Okay. But if they've been driving and there haven't been any accidents, do we just wait for them to start having accidents?
Well, you can, if you're worried, you can get them a driving test, like a simulation test. You can get a referral for occupational therapy driving assessment. And there's a website you can look up like where they give these kind of driving simulation tests. And it's usually in like a hospital setting where the occupational therapy have like a simulation machine where the older adults like drive in front of the simulation, and the OTs assess their response times and whether they're making the right choices on the road on the simulation, and they can give you a better idea of whether it's safe to be for them to be on the actual road.
Okay, thank you.
Yeah, for driving, yes, I am an optometrist, so I constantly have a exam room dispute between the elderly and the not so young kids, the children, about driving and associate other rights. I think to me, taking care of my mom, I felt like one of the biggest challenges that we family member facing was a different decision making, like how much you want to take away from your elderly parents, how much decision you need to step in and make for them. And every family members had different takes, and we grow up like so used to being obeying our parents, and so it's very hard to switch the role. It's very hard to, and then so what degree, in every little thing. So I'm in my 50s. I started to talk to my adult kids, what I could allow them to take over at what point. So be a lot more specific to prepare one day, if I become my mom, what my kids should agree to do together. So I think there is a period of time I found our family members had a lot of arguments, on this issue, whether we should let our mom do silly things or whether we should just take over and do things that's supposed to be better for her. So I think that's such a big challenge.
Yeah, it is definitely a very big challenge. And yeah, that role reversal that you talked about, our parents used to be the ones to take care of ourselves. And then as they get older, we become their caregivers. And that is very difficult role reversal. And as you kind of said before, if you had time to talk about these things earlier on when she didn't have as much issues, it might have been helpful for, and write that down on paper or legal work. That might be helpful for her to just know, oh, like, I wanted my kids to do this, and yeah, like as I said before, older adults, they really value their independence, and oftentimes they again fight with their children about what can they do by themselves. And I do want to encourage them to stay as independent as possible as long as it's safe. But yeah, oftentimes it's hard for the caregivers to assess, what is safe, like, how much can we push the limit? And that's, something that's very individualized to the family and the person. So.
Okay, it's 10:30, so we just wanted to we would like to end the workshop for this one for now, so that everyone can take a break. And the next session will be 10:30. It will be in this same meeting link, so you can stay and just take a break and come back. So once again, thank you, Dr. Cecilia Kai, for today's workshop, and appreciate everyone's joining us today.
Oh, and in addition, if you are going to be attending the Advanced Directives workshop in Mandarin, that is a different link. So please check that webpage that Dean has on the screen, or go to the HCC website. So you're in the correct workshop.
I apologize. What's the difference between these two workshops besides language?
The Advanced Directive Workshop at 10:30 is in Mandarin, and it will be repeated at 3:30 in English.
Okay. Okay. I got you. Thank you.
Thanks.
Okay, I just shared the link for the Chinese workshop at 10:30. So if you would like to join that workshop, you can click on that one. It should take you to the other meeting. So, all right. Thank you, everyone.